Boker Tov, good morning. It's good to have you all here with us today. Before I welcome up Dr. Laurie Rothman and introduce her, we're here as the first session of our wellness series, and I've invited a doctor. Why? Because it's very Jewish to take care of yourself. Everybody knows the term pikuach nefesh, which means, saving a life is of the utmost importance, which of course today, as 3 of the hostages are being negotiated and brought back to Israeli hands, is very, very critical and acute for us. But going back to ourselves in the physical body, Mishnah Torah says, since maintaining a healthy and sound body is among the ways of God, one cannot understand or have any knowledge of the Creator if he is ill. Therefore, he must avoid that which harms the body and accustom himself to that which is healthful and helps the body become stronger. We are commanded to take care of ourselves. And the rabbis further developed that through our morning blessings, the ones that we begin with in the morning. Baruch atah Hashem Elokeinu melech haolam asher natan lasechvi bina lavchin ben yom uven laila, right? Our morning blessings. When you open up your eyes, you should say, blessed are you, Adonai, our God, who rules the universe, who opens the eyes of the blind. When you sit up and stretch, you should say, blessed are you, Adonai, who sets free the captives. When you stand up straight, you should say, blessed are you who raises the bowed down. When you walk, you should say, blessed are you who makes firm the steps of man. This is our commandment, and this is what we should be grateful for each and every day. So it is upon our shoulders to take care of ourselves. Dr. Laurie Rothman is here. She's been in our community for 22 plus years. She is a concierge doctor of Tampa General, and she is one of our congregants and one of my family members, which I am grateful for. And she has come to discuss with us healthy habits, healthy practices, and preventative medicine. Please, Laurie, so good to have you here.
Thank you. Thank you, Rabbi, for that introduction. And when Rabbi asked me to speak on this topic, this is absolutely one of the topics that's nearest and dearest to my heart, is preventive care. I'm a family physician, and to me, of everything I do, this is by far the most important piece. So what I want to talk about today is preventive healthcare, wellness, self-advocacy. With respect to preventive care, well, why is it important? I want to talk to you about why it's important, and then give you some recommendations about how to make the most of your time with your doctor. I discussed the terms health and wellness. We throw these terms around all the time. Health and wellness. There's seminars, there's lectures, there's videos, and what does it really mean? Like, what are we actually saying? I want to get into why it's important to advocate for yourself, how to make the most of your time with your doctor, because we know the average office visit's like 15 minutes, and sometimes it can be as little as 7. So how do you actually get what you need out of that time? And then there have been a lot of changes in preventive care over the past couple of years, so I want to highlight some of those. It's a small group, so if you have questions, if you want to focus on a specific topic, feel free. I want to make this work for you, for what you need. Preventive healthcare can lead to significant improvements in your overall health and well-being and longevity. Many people avoid seeing their doctor. They feel, I'll go if I'm sick, if I have a specific problem that needs to be addressed, or if I don't feel good. However, as a family physician, I think that preventive health care visits are the most important ones. Preventive health care refers to the routine care you receive to maintain your health, prevent chronic illness, and address things that can be serious before they happen. So preventing serious diseases is one of the most important things you can do to protect your health. Unfortunately, many people don't get the preventive care services that they need. One study from 2018 showed that only 8% of adults over 35 had all the recommended preventive care service that were recommended to them to their doctor. 8%. So I had to look at this study because this is shocking to me. And it turns out that women were a little bit better than men. But that didn't surprise me because a lot of times the women are the ones who are kind of taking over the healthcare for their whole families. And that as people got a little bit older, they also were better at engaging in some of these services and seeing their doctors. Some of that maybe people start to notice things are, going wrong. They start to get a little more intimidated by things that might be occurring or looking towards the future. But I think also sometimes as you get older, you have more time. Like you're not in the midst of like full-time work and taking care of a family, and now you have actually time to focus on your health. There was another study from the Kaiser Family Foundation that showed that 92% of adults in the United States think, yes, it's important to get an annual physical. But only 62% of them actually got the exam. And that was pre-pandemic. We know that preventive care basically plummeted during the pandemic, and we're just starting to see that recovery now. So what is an annual physical? What should it be? So when I talk about an annual physical, what I mean is an annual face-to-face visit with your doctor where you go over your medical history, anything that happened in the past year that might have changed health-wise, anything in your family history that might have changed, because we have your family history on the chart from that first visit, but if I've been seeing you for 5, 7, 10 years and a new illness developed, your brother had a heart attack, someone developed cancer, I need to know those changes so I can look out for you and your risks. But if you don't tell me, I don't know. I want to update your medications. I want to know, well, did your cardiologist prescribe something else that I don't know about? One of the most important parts of my job, in my view, is making sure that at least one doctor has a comprehensive list of medications, herbs, vitamins, and supplements that you're taking. Especially for people who have specialists and multiple prescribers, there can be a lot of duplication. And I've had patients come to me on 2 medications, the same class of drug for the same condition by 2 different doctors. So that's really important that you come with that list. And then I want to review your status as to all your preventive care screenings and recommendations. The actual physical exam part of the exam, honestly, is not the most important. I think it's the least important. There have been studies that actually showed that it doesn't change health outcomes at all. It doesn't mean we don't do it. Occasionally, I'll find a physical exam finding that matters, but the conversation is actually the most important part of that visit, and the relationship building with your doctor, where you trust them to give them all the information, and that you're truthful with things about your social habits as well, like not telling your physician if you smoke or how much you're drinking or about the stress levels in your life is not helping you. So to the terms health and wellness, we often use them interchangeably. Although a person can have one and not the other, there are 2 different concepts that are quite variable and their meanings are different. According to the World Health Organization, health is a state of complete physical, mental, and social well-being, not merely the absence of disease. Wellness is the optimal state of health of individuals and groups. Wellness is expressed as a positive approach to living, and that journey of wellness is what can bring us to a state of health. The primary difference between health and wellness is that health is the goal, and wellness is the active process of achieving it. You can't truly have health without first achieving wellness. Wellness has a direct influence on overall health, which is essential for living a robust, happy, and fulfilled life. Physical health is maintaining a healthy body through physical activity, good nutrition, good sleep, social network, preventive care. Mental health is psychological stability and emotional balance. Wellness is the holistic approach that includes mental, emotional, physical, and social well-being. And you can put spiritual being into there as well. So the key pillars: physical health. First thing that comes to mind for me is nutrition. It's what we put into our bodies. There's so much information out there on what to eat, what not to eat. But I think a lot of the most basic principles remain true. The things that are not fads are the things that we can kind of always go back to. So what is a good, healthy, balanced diet? It's what we eat and what we don't eat. Whole grains, vegetables, fruit, lean protein, healthy fats. Those are the things that should be the foundation of our diet. avoiding ultra-processed foods, highly processed foods, the white foods, the white flours, the sugars. Those are the things that are going to cause more inflammation and more long-term problems with cardiovascular health and risks of cancer. Hydration. Water is your best friend. And I don't think you have to walk around with a water bottle all day long, but making sure that you're getting 60 ounces of water a day and that you're not getting your hydration through sodas and sweetened beverages. It can be in the form of herbal tea. It doesn't have to be water. It could be soups. It could be anything that's going to be nourishing and hydrating. Vegetables and fruits have lots of water. So I often say you can get hydration through that as well. Physical activity. I don't like to say exercise. I like to say physical activity because it doesn't have to be structured exercise. Anything that gets us up, moving. Anything that's basically not sitting. So what are the benefits of regular physical activity? Reduction in cardiovascular disease, reduction in stroke, reduction in obesity, reduction in diabetes, reduction in cancers. The American Heart Association currently recommends that all adults get 150 minutes of moderate physical activity every week. What is moderate physical activity? What do we mean by that? So that could be brisk walking, it could be dancing, it could be doubles tennis, it could be a bike ride. It can be divided into 5 30-minute sessions. It could be 4 45-minute sessions. It could be an hour 3 times a week. It's however you can break it up. There's no one right way to do it. If you can get 15 minutes in the morning and 15 minutes in the afternoon, that's great. Do it. If you can just take a few minutes, stand up, walk around, get up from your desk, move around, stretch, do it. It's going to be good for your health. It's going to make you feel better. It's going to be good for your physical health and your mental health. More is better. So the minimum recommendation is the 150 minutes, but 300 is shown to be a better amount. I want everyone to start where they're at. If right now you're not getting any, focus on getting 30. Build it up to 45. Whatever you do is going to be better than doing nothing. Sleep. Sleep is so important, and it's the one that often gets overlooked. Sleep supports physical recovery, it supports mood, it supports cognitive function. It's not always easy to come by. There's a whole part of medicine called sleep hygiene, but there's some basic things that we can do to try and help our bodies get good sleep. One is to set enough time for sleep. Because if you're only giving yourself 6 hours, well, the chances that you're going to get the 7 to 8 that we're recommending, it's not possible. So having a set bedtime and a set wake time can be really important, and it can really help your physical and mental health. Having a room that's dark, that's cool, doesn't have distractions, where you're not on your phone in bed, and you're not watching TV in bed, you're not having stressful conversations in bed. Your bedroom and your sleeping area should be a place of respite, where you can actually relax and give your body the time it needs to rest and recover. So that's physical health and mental health, but specifically for mental health. Managing stress, much easier said than done, kind of like getting good sleep. But there are things we can do to help us manage stress. Meditation helps, and it doesn't have to be an hour of meditation. There are apps like Headspace and Calm, where you can do a 5-minute meditation. You could do a walking meditation. Not everyone can sit still for it. It's not for everybody, but it's one avenue. Deep breathing exercises, even a few minutes, 90 seconds, where you change your respiratory rate and take deep breaths, can reset your body, bring you to a calmer place, actually lower your heart rate and blood pressure. Or hobbies, anything that you love to do, like gardening or art. Those are wonderful ways to support your mental health. Cognitive well-being. As we get older, we worry about our cognitive health, our ability to focus, to get tasks done, to remember. So staying mentally active is really important for this. And that could be through active learning, through taking a class. It could be a class online, it could be a master class. It could be through just regular avid reading, learning a new subject. It could be learning a new language. It could be even doing something like Duolingo, where you're spending 5 minutes, studying Chinese or French. Puzzles, games, crosswords, chess, anything that gets our mind, music, learning an instrument, those are all things that can really support our cognitive health, protect our memory. Emotional health, self-awareness, recognizing when you're stressed, because we don't always recognize it, and seeing if your shoulders are like this, if your body's tight, your jaw is clenched, recognizing it. Can't always do something about it, but once you see it's there, then maybe if you find that you're routinely stressed, going and seeking help. Help could be talking to a friend, it could be going to a therapist. Self-care, another term we throw around all the time, self-care. What does it mean? It means taking a little bit of time for yourself to do what you like. It's not for you, it's not for someone else, it's for you. It could be through a hobby, through an activity, anything that brings joy to you. It could be 5 minutes, it could be an hour a week, but it's really important to figure out, what do I need? And we don't always know what we need. Social health, and this is the one I think has become really notable and important, especially after the pandemic, where we became as a society so socially isolated, and a lot of that didn't recover. People don't spend as much time with family and friends as they did before the pandemic, and it's really bad for our health and well-being. Building meaningful relationships, communicating, maintaining a social network is very important. In 2023, our Surgeon General declared an epidemic of loneliness. 50% of US adults felt lonely. Loneliness isn't just a feeling though, it's actually a health risk. We know that people who feel lonely, who feel socially isolated, who don't have those connections, have an increased risk of cardiovascular disease, dementia, stroke, anxiety, and premature death. Loneliness was equated to smoking 15 cigarettes a day. So it's something that we can't only address as individuals, we have to address as a community. If we identify people in our community who seem isolated and lonely, finding ways to bring them in. It's something that needs to be addressed on a community level, on a state level, on a national level, and on an individual level. Okay, so I'm going to jump back to preventive health screenings. We talked about why they matter. So which are the ones that we should talk about? There were some new and updated recommendations in the past couple of years. So what we're going to talk about now is like 2025, latest things we should be doing. Breast cancer. Over the past years, the recommendations for when we should be screening for breast cancer have changed. There are different societies like the American Cancer Society versus the American College of Obstetricians and Gynecologists versus the United States Preventive Healthcare Task Force, always have different recommendations. Finally, in 2025, the United States Preventive Service Task Force recommends starting mammograms at age 40 for women of average risk rather than at age 50. It's a really important recommendation. Women who are high risk, the recommendation may be as young as 30 or 35, but this is for your women without a strong family history, without a personal history. So age 40, all women should be getting their baseline mammogram. And the frequency should be every 1 to 2 years for women age 40 to 74. After age 74, that's kind of a personal conversation with your doctor based on your longevity, your other health conditions, and your family history and your personal history. Colorectal screening. Updated guidelines. Colorectal cancer screening should begin at age 45. Typically, for years and years, it was age 50, but there's been a significant increase in colorectal cancer in young adults. So all adults should be screened at 45 unless they have a family history, in which case that's going to be a different recommendation depending on who had the cancer and at what age. So with a minimum of 45, and that can be colonoscopy, it can be a test for blood in the stool, it can be the Cologuard test. The colonoscopy is the gold standard and it's the best test, but typically I'll take what I can get, and if my patients are willing to do any screening, we'll start with that. Lung cancer screening for smokers. This is probably the most underutilized screening tool that we have. Less than 10% of the people who should be doing this screening actually do it. The guidelines used to be a little confusing, but they're very clear now. Adults age 50 to 80 with a history of smoking, past or present, who have at least 20 pack years of smoking. So 20 pack years means you smoked a pack a day for 20 years, that's 20 pack years. You smoked half a pack a day for 40 years, that's 20 pack years. They should have an annual low-dose CT scan to screen for lung cancer. What this does, it's not like colon cancer where we can actually prevent cancer by catching a precancerous lesion. This is early detection. If you catch lung cancer at stage 1, it's very treatable. So the idea is if you find something that looks like it's precancerous, cancerous, you find it as early as possible, giving your patient or yourself the best chances for survival, longevity, and a less complicated treatment course. We know it reduces mortality. Cervical cancer screening. Women aged 21 to 65, women under 21 don't need pap smears. Women over 65, for the most part, don't need pap smears. Women who've had a hysterectomy for non-cancerous reasons don't need pap smears. So, and that screening can be done every 3 to 5 years, as long as you're doing it with the human papillomavirus screening. And we have the HPV vaccination to all our kids starting at 11 to help prevent HPV-related cancers. So those are the main cancer screenings. Cardiovascular health would be the next one. You want to know your numbers. At least once a year, you should know, what is my cholesterol, what is my blood sugar, what is my blood pressure, what is my weight, what is my body mass index, and how do all of those things add up to my personal risk for cardiovascular health. So I'm not going to get into all the individual numbers right now, but those are the things you should go and you should make sure your doctor is checking for you. When you leave your physical, you should know all of those numbers, how it applies to you, if you should be treating something, monitoring something. And treating doesn't necessarily mean a medication. It might mean a lifestyle change. It might mean taking some salt out of your diet. It might mean taking some sugar out of your diet. It might mean adding more fruits and vegetables. It might mean saying, okay, I'm not getting those 150 minutes a week, but based on my cholesterol being 220 this year rather than the 180 it was last year, I need to up that exercise. So you should know your numbers and have a treatment plan associated with them and a follow-up plan if needed. Mental health and cognitive screenings. I had heard a study recently that was saying that over 75% of women who went to physicians said they hadn't been asked about their mental health and that they wanted to be. Now, we do screenings for depression and anxiety for every new patient and every physical. So at least once a year, you should be screened for depression and anxiety. Depression doesn't always come like I feel depressed. Depression can come with I'm exhausted and I don't know why. I can't focus. I'm just feeling like I don't want to do anything. I've lost my motivation. So a lot of times we have depression, but we don't recognize it as such. And that's something your doctor should be actually asking you about. Cognitive decline and dementia. Routine screening for adults 65 and over should absolutely be done every year. And there are some in-office tests that don't take a lot of time that can be done. So for my patients over 65, I do at least a basic screening, and then I might go into more detail if they're telling me that they have their own personal concerns of early dementia or Alzheimer's disease. Because there are normal changes with aging that happen to our memory. I don't know where I left my keys, or I'm at the grocery store and I don't remember my list, or what is that person's name, but it's somebody you only see 4 times a year. Those are normal things. When it's functional things, then I start to get concerned. When you start missing appointments, or you're driving someplace you've driven 10 times before and you don't remember how to get there, or you're trying to make a recipe and you've made it, dozens of times and now you can't remember what you made. Those are the things that concern me, the functional changes. Your physician or healthcare provider should go over all your vaccines with you and make recommendations based on your age and health risks about what those vaccines should be. There are some newer recommendations in the past few years. There's a newer pneumonia vaccine that you want to find out. It's called Prevnar 20. If you're a candidate for it, if that's the right vaccine for you. Adults who are high risk or over 75 should be getting the RSV vaccine. And all adults over 50 should be getting the shingles vaccine. I'm a strong advocate of flu vaccines. Everyone over 6 months should be getting one every year. And then for COVID, the CDC is recommending that adults receive a booster shot at least once a year, particularly those over 65 with underlying health conditions. Vision and hearing, those should be screened annually starting at 40 for vision and 60 for hearing. But it's personal. Like, you should have your own personal health care plan. When you are going to an appointment with your physician, in order to make the most of that appointment, it's good to be organized. So if you're calling up for a sick visit, or because you have a symptom that you don't know what it's about, let the office staff know why you're making the appointment so that they can allocate the right amount of time for you to have that appointment. If you're coming in for a cold, it's going to be very different than if you're coming in with, I think I'm having chest discomfort. Like, you want to make sure that that doctor has the time for you for that visit. And if you're having a physical, make sure that they know you're scheduling for a physical. It's not always intuitive. When you're coming in for whatever it is, if you're coming in for symptoms, write them down. Write down what your symptoms are, if you have a timeline, what you've done to try and alleviate them, and any questions you might have. And if there's something in the back of your mind that's worrying you, like I'm having headaches, and some people won't tell me. I think, my mother had a brain tumor when she was my age. Tell me what you're worried about. And this way I can say, oh, okay, no, this doesn't seem anything like that, or maybe we should do more investigation. But if you don't share that concern, your doctor won't know. If you're going in for a serious diagnosis, if you have new cardiovascular disease, if you've had a stroke, if you have a new cancer diagnosis, have somebody with you. Make sure, don't be alone, because you won't remember half of what is being said at the visit. Educate yourself about your conditions. Know what it means. Do your own research. Make sure you have a list of the other physicians you've seen, what's been done. If you have records, bring them with you so that your doctor's not starting from the beginning. Whatever you can provide will be beneficial to you. Always come in with a list of medications, a list of vitamins, a list of supplements for your chart to be updated. So advocacy. Ask questions, keep records, be an advocate for yourself, be assertive when needed. If you don't feel like you're getting what you need, say something. Bring family and friends with you. This is your time. This is your time with your doctor. So my overall message is, get your preventive care. Have a relationship with your physician. Feel comfortable to ask the questions you need to ask. Make sure you have a plan of care. And if you don't advocate for yourself, nobody else is going to. Any questions or topics you'd like me to expand upon?
Thank you so much, Laurie. I think this was so helpful, and I know that this is something that is so important to each and every one of us, and I know that Laurie is available if anyone has any questions. Thank you so much.
It's my pleasure.
This
Thank
is so
you.
helpful.